Hello and welcome to Newsbreak at 7. I'm Veeraraghav. A major health alert is our top focus. A major health alert in the state of Kerala after cases of Nipah virus infection was confirmed by the National Institute of Virology of Pune. Two unnatural deaths led to suspicions of Nipah and samples were sent to the NIV for testing and the confirmed results are out. That's big breaking news at the moment. So a lot of precautionary measures are in place. Remember, Nipah is that deadly virus, zoonotic virus, which spreads from animals to human beings. It's not highly contagious, but it's extremely deadly virus. Remember, 2018, Kerala had seen an outbreak of the Nipah virus. So we can confirm to you that testing samples that were sent to the National Institute of Virology, according to reports, is confirmed to be cases of Nipah. Obviously, Kerala extremely responsive to this entire thing, having seen it in 2018 as well. My colleague Uma Sudhir, who's been tracking those developments, joins me on the phone line. Uma, obviously the confirmation coming in, Kerala extremely responsive to this, which is why precautionary measures had already kicked in and the protocol was in place as soon as unnatural deaths were reported from Calicut, Kozhikode in Kerala.
Yes, indeed. Dr. Veena George, in fact, has spoken about the protocols kicking in, and they were prepared, as you mentioned, before itself. And the big worry with something like this is the big mortality rate. If they are able to contain the virus and do the contact tracing and ensure that those people remain isolated, it's a kind of a self-solving problem in that sense, because the disease takes care of itself, and that's what the Kerala government is hoping. But yes, the first death happened on the 30th of August, and the second death, in fact, happened yesterday. And both those people were in contact, and at least 3 other people, family members, are said to be in hospital. The rest have been isolated. Whoever they came in contact with have already been isolated, and one person is in the ICU. So that is the worry because of the nature of the disease itself. But the Kerala government acting quickly, and now that the confirmation has come, the entire protocol very much in place to ensure that the spread does not happen from this area and it remains endemic to Kozhikode, where, as you mentioned, a couple of times in the past, in 2018, 2021, also we have had the breakout of the virus happening. And obviously, even before the COVID happened, Nipah was something that had created a big scare. And in 2019, we even saw a film by the name of Virus, which had captured the entire fear around Nipah and spoke about how the response actually of the public and the administration should be.
Right, important points there, Uma. And as you point out, obviously swift response from the Kerala government as soon as, it's primarily because of the protocols in place in that state, that as soon as unnatural deaths were reported, 2 of them in Kozhikode who were in contact, immediately protocols kicked into place and samples were sent to NIV for testing. As we can report right now, NIV has confirmed these to be cases of Nipah. Joining us this evening is also Dr. Sulfi Nuhu, President of the Indian Medical Association's Kerala chapter. Dr. Nuhu, tell us what happens now that it's confirmed cases of Nipah, A, within Kerala, B, also tell us how it would be communicated to other neighboring states, perhaps.
We all know that the Nipah is not a highly infective disease. The infectivity rate is very low, and also, but definitely the mortality rate is also very high. But I think there is nothing to worry as far as the neighboring states are concerned, or maybe also for the travelers traveling across Kerala, or maybe traveling inside Kerala. There is nothing to worry at all, because the Nipah is a self-limiting illness, and it has happened in many parts of the world. It has happened in Bangladesh and maybe in Malaysia and Singapore also. In all these countries, it was a self-limiting illness. It will happen only like that only. We are doing adequate measures and we are doing the contact tracing. And the contacts, most of the contacts have been identified and they are quarantined. And I think they are separated from the crowd. And I think the adequate measures are being taken. But still, we have to we have to expect maybe more cases coming up. But then we have done the homework already, and we have previous experience also. That is very, very important. We have controlled Nipah, and in fact we have identified Nipah. Diagnosed Nipah, much within a short span of time during the last infection. So I think we are confident enough to manage the Nipah this time also.
Oh, absolutely. In fact, the fact that as soon as unnatural deaths were reported, containment exercises started and protocols kicked in is important to note there. Just tell us a little bit more about the virus itself. We do know that it's a zoonotic virus, which transfers from animals to human beings and then person to person. And as you pointed out, it's not highly contagious. The spread rate is much lower, but it is quite a serious virus, isn't it?
Yeah. Actually, the symptomatology is, it's just like another fever, maybe fever, body pain, vomiting, headache, and all those things will happen. And only if it affects the respiratory system, severe respiratory failure, or maybe due to, maybe if it affects the brain and encephalitis develops, then it is a problem. So if the complications develop, then the mortality will be high. So that's it. But primarily, what we have to say is that those people who are in contact with these things, or maybe in the high risk population, those who are dealing with maybe they are in close contact with history of close contact with the bat and all, or maybe the juicers, or maybe the fruit dealers. Those people have to take a little precaution, and they have to report if these symptoms come up. They have to report immediately.
So at the moment, Kozhikode, there will be some containment efforts that will be on. We believe the health minister is also there reviewing measures that are going on there. If you can give us any details that you may have at the moment, sir.
Yeah, actually, there is no closing down of Kozhikode and all. Kozhikode, everything is running very smoothly, as nothing has happened. But there will be restrictions inside the hospital. Okay, I know that we have asked people not to go to the hospitals if it is not required. But that means like visiting patients, or maybe unnecessary visits must be avoided to the hospitals. But then, others, everything is perfect in Kozhikode and other parts of Kerala.
All right. So for the moment, we know that there were 2 unnatural deaths, following which NIV samples were sent across to the National Institute of Virology, which has confirmed these to be cases of Nipah. We believe 4 more people have been isolated who were in touch with these people. Any other information that you may have as the last question that I have for you, sir?
Yeah, actually, we have around 70 plus contacts there. The history of contacts with these suspected contacts with these patients. So we are isolating those people, and we are doing that groundwork, and also other possibilities of further contacts. We are also looking for that, and I think we may be able to trace all the contacts within hours, or maybe within days, and we can do other work also in a short time.
Okay. Sir, also, I just wanted to check with you in terms of Kerala. Often there's been a lot spoken about the responsiveness and how the protocol kicks in terms of Kerala. In fact, there are those observers who point out that in some other state, it may have gone completely unnoticed. How does this process actually work in Kerala? How does the system respond to it? And as soon as there is an unnatural death, how does this trigger off the next set of exercise on the protocol to ensure that there is containment and spread of a virus?
Yeah, absolutely. See, basically there are many factors affecting. We have a very, very strong health system. We have a primary, secondary, and a tertiary care system. We have a private, public. Both the private sector and the public sector both are very, very strong in Kerala. And most importantly, the awareness among the public, the literacy, the health awareness, those things are very high among our public. So they usually report to any unnatural thing, and they'll be visiting doctors, and they will be seeking treatment. That is the preliminary thing. That's the first thing. Secondly, we have an experience of Nipah coming out in Kozhikode, and in fact, in a private hospital, after routine examination and all, nothing was coming out, and he had a strong suspicion of Nipah in the last episode, maybe the previous episode. So similarly, we have two unnatural fever and not responding to conventional treatment, and the patient is becoming critical very soon. So they suspected Nipah, and that's a system happening. Even during the COVID, we did perform reasonably well because of that system existing in our state.
Right. Right. Thank you so much, Dr. Sufi. Obviously, all measures there in place. There's nothing really to worry about, but the fact is that Nipah has been confirmed after 2 unnatural deaths in Kozhikode in Kerala, and a few other people who were in contact with the victims have been put in isolation. We'll keep a close track of that. We'll also try and go across to the Health Minister of Kerala, Veena George, as and when we can for more details and updates.